Dear friends, I am Dr. Santosh Karmarkar, a pediatric surgeon at the Lilavati Hospital in Mumbai. Today I am going to talk to you about birth defects. The 3rd of March every year is observed all over the world as World Birth Defects Day, and this is to draw attention to the various medical, rehabilitative, socio-economic, public health issues related to the major medical problem of birth defects. Like manufacturing defects, nature also is not always perfect. And at times, a baby who is developing in the womb can have a small manufacturing defect or sometimes a major one. And this problem of birth defects is actually quite common. In India, we have some of the highest incidences of birth defects. As many as 50 to 70 children out of every 1,000 are born with birth defects. Birth defects, as I was mentioning, can be very simple, very minor, very benign, like having a 6th digit. On the other hand, you can have birth defects which can be life-threatening. For example, a life-threatening birth defect is of the trachea and the esophagus. That is the food pipe and the windpipe. When both of these are abnormally connected to each other, that birth defect is called tracheoesophageal fistula. And if it is not diagnosed and treated immediately after birth, it can be life-threatening. Birth defects can be due to various reasons. A majority of them can be due to maternal conditions such as diabetes, hypertension, maternal infection. But the commonest birth defect in India, which is a birth defect of the spine and which is called spina bifida, happens due to a nutritional deficiency in the mother. So when a woman has a deficiency of folic acid and becomes pregnant, then that decreased folic acid in the baby can result in a big severe birth defect of the spine called spina bifida. India has again the highest prevalence of spina bifida cases, and as many as 4 per 1,000 children have spina bifida, which is also called a neural tube defect. The other causes of birth defects can be genetic, can be environmental. That means if the mother lives in an area with high radiation, it can lead to birth defect. Extreme temperatures, women living in deserts with high temperature, there also birth defects can be very high. So a lot of environmental factors, pollution, which we all talk about nowadays, can also lead to increased number of birth defects in the developing baby. So birth defects is a huge topic. It's a big medical issue. It's also very fascinating to know how the baby develops as a complete human being with a complicated body just from 4 cells. And that is what the science of embryology is all about. I mean, knowing that is also so interesting and fascinating. To give you a very interesting example, scientists have been studying for long how a developing baby decides which is its left side and right side. How is the heart always onto the left? How is the liver always onto the right? Can you imagine how that developing mass of cells decides what is left, what is right? So there are several interesting, fascinating topics related to birth defects. Birth defects, as far as treatment is concerned, also is a challenge. And as a pediatric surgeon, the birth defects that we treat are mainly structural birth defects. That is, birth defects which cause abnormal structure and not functional birth defect. Functional birth defects are treated by physicians, pediatricians. Structural birth defect, anatomical birth defect are treated by pediatric surgeons. So pediatric surgery, the sense of a pediatric surgical specialty is the treatment of these birth defects. And it is said that a child is not a miniature adult. This is the reason why pediatric surgery separated from adult surgery as a new separate discipline, because operating on a newborn, on a 1-day-old, is completely different from operating on a 50-year-old person. So the essence of the specialty of pediatric surgery is the surgery of birth defects. So how are these birth defects diagnosed? Now, with advances in ultrasound, MRI, and various other techniques, genetics, etc., we can diagnose a majority of these birth defects before birth, antenatally diagnosed birth defects. So a family, the doctor already knows before birth that there is this particular defect in that child, and everyone can be better prepared to treat it. You can now diagnose birth defects in the fetus, and you will be surprised to know that many of these defects now can be operated before birth. And one of the latest emerging developments in pediatric surgery is the field of fetal surgery. At the 4th month, 5th month of pregnancy, you operate, you just take out the part of the fetus outside the womb, repair it as you would do after birth, put the fetus back in the womb, and carry the pregnancy to full term. So this is now possible, and the commonest birth defect that we spoke of, spina bifida, is now operated in many parts of the world before birth. In the Lilavati hospital, we have all the experts and specialists who have spent a lifetime operating on these tiny babies who have complicated birth defects. I remember many years back, I did an 8-hour operation on a 6-hour-old girl. And after she came out of the operation theatre, more than half of her lifetime was in the OT. Today, that girl is in college and doing very well. So, birth defects, though challenging, if they are properly operated, many of them can be successfully treated. Not all of them, but several of them. And for this, of course, we need experts, we need people who are trained to do these surgeries. And these surgeries can be of the urinary tract, of the heart, of the spine, the nervous system, and so on and so forth. So it is on World Birth Defects Day, that is 3rd of March, that we want to focus on birth defects. And lastly, what I would like to say is that prevention is always better than cure. And therefore, if you can prevent these birth defects from happening, then that's the best thing that should be done. Thank you.